Pierce.
Hello, I'm Linda Pierce, the Public Health Nurse in the town of Westport. Tonight's subject is Alzheimer's Disease Awareness Month, but we're going to talk about flu season first. Our flu season vaccine clinic schedule as of Monday, Wednesday, and Friday, 8 a.m. to 11:30. Please call for an appointment. Bring your photo ID and all your health insurance cards. Flu vaccines will not be administered to anyone who has been ill in the last week. Please reschedule if necessary. Prevention is the key. Get your flu vaccine, wash your hands, stay away from crowds, cough or sneeze into your sleeve. Someone who is sick should use separate towels or paper towels and use hand sanitizers. The flu is spread through droplets like spit or mucus from the nose, the mouth, and the throat. This happens when a person with the flu coughs or sneezes within 3 to 6 feet from you. Sometimes people get infected by touching doorknobs or telephones or anything. Be very cognizant of what you're touching during flu season, and you should be carrying sanitizer with you anyway. Alzheimer's disease is a type of irreversible, progressive brain disease that attacks and destroys the brain cells, which results in the loss of memory and essential cognitive functions. The neurodegenerative disease is responsible for causing up to 60% of dementia cases. Contrary to popular belief, Alzheimer's disease should not be considered a normal part of aging, as approximately 200,000 people under the age of 65 have been diagnosed in the United States alone. Symptoms of the disease worsens over the years and are eventually terminal. There are 7 stages. No impaired behavior. A patient does not exhibit symptoms of memory loss or other cognitive impairments during stage 1 of Alzheimer's disease. The only way the disease can be detected during this stage by a PT scan, which is an imaging test that studies how well the brain is working. As the disease progresses into other stages, a patient will experience more changes in their reasoning or thinking. Stage 2, very mild impairment. Patients with stage 2 Alzheimer's disease still may not show symptoms, or they may exhibit very mild cognitive impairment. In most cases, memory loss associated with this stage is difficult to differentiate from the symptoms of normal aging. A patient with stage 2 Alzheimer's disease may still do well on memory tests, and symptoms are unlikely to be picked up by a medical professional yet. Stage 2 is characterized by small changes that do not interfere with a patient's ability to live on their own. Stage 3, mild decline. By stage 3, a patient's medical doctor and family members may begin to notice memory and cognitive impairments. The 3 most common areas affected during stage 3 of Alzheimer's disease are planning and organizing, finding the right word to describe feelings during conversation, and remembering names of new faces or people. A patient with stage 3 may finally show signs of Alzheimer's disease on memory and cognitive tests. During this stage, it is common to lose personal possessions such as keys, money, and other valuables. Stage 4, moderate impairment. A patient will often forget important details about themselves, forget what month it is, or time, or day, or year. It is recommended that patients in this stage no longer drive and are protected from being taken advantage of financially. Stage 5, moderate severe impairment. During stage 5, patients often experience significant confusion, resulting in the inability to get dressed or recall simple tasks like their phone number. They can usually bathe and use the restroom by themselves. They may also still recall family members, names, or details about their past. They may repeat themselves or ask the same question over and over. Stage 6, severe impairment. Confusion, not being able to patient's surroundings and their environment. Extreme personality changes and behavioral problems. Inability to recognize faces except for the very close friends and relatives. Loss of bladder and bowel control, and wandering. A stage 6 person will need to be supervised. Stage 7 is very severe decline. May have inability to swallow, the need for assistance in life's activities, and failure to speak anything except a few words. A patient in this stage is considered to be a near death. Alzheimer's disease is a terminal disease, may no longer be able to recognize their loved ones. I have a list of different facilities that do day care, and I have them on the board, one being Catholic Memorial, the Cedars, Brandon Woods. They have two facilities, one in Dartmouth and one in New Bedford, and Active Day, and that's up in Welby Road in New Bedford. Very serious thing, and people really need to pay attention. Any questions?
I dare not ask.